every day, I know. However, I found myself, I would like to continue and not missing on what I have committed to and the neuroanatomy of aggression and how it can manifest and how the environmental and cross-culture context influence the phenomena, how we face little parts of the self, like for example cognitive dissonance, self-distortion, self-deceptions, and the impact of stress, trauma in both health and disease. So I would like to bring another piece of intersectionality between aggression and the other um, a manifestation of the accumulation of multiple incidents, multiple events, and go deep down into the attachment theory. It goes down into the intergenerational biomarkers from survival for the tribe and fight, flight, freeze from the maternal stress and the accumulation over time within the social determinant of health, health disparities, inequalities, and all of that. And if we see the root causes, we go down. It's everything is. I consider chronic illness and psychiatric conditions is a social disease, and it's a chronic diseases. It has to be treated on continuum, and it is not being perceived as they are acting out of character, or there is more to the story. And if we are able to open ourselves to understanding what is more to the story within the self first, then we can relate, then we can see a different perspective into human behavior. This is my introspection or through aggression and how it manifests in life, and the accumulation of its outcome on how the perceived reality, perceived stress, perceived threat, and perceived pain. So all this is you are a living creature, you are fearfully and wonderfully made. So all this intersectionality are so complex, you are not meant to be like an easy like equation to fight for like millions of years on earth, and you still surviving. However, survival is stuckness, it is not living. There is a huge difference between the survival. I'm gonna make it a minute by minute. So many goes through this phase, and life happens, and there are life events, but we don't ignore the consequences and that over time on the neurobiology of the human perception, memory, functionality, adaptability, and showing up in the world. Sometimes we overload the central nervous system that it comes to a moment that it cannot take anymore. Whatever many are trying to pretend everything is okay and that I'm fine. This is the global lie that everyone is telling it. We say it as like we don't want to go there. We don't want to open the conversation further. So I'm fine. I'm okay. I'm fine. I'm okay. And that is a closed session. However, when you started to dig deep into why I am feeling this way, why I am experiencing this way, why I am keep repeating the same patterns every time. So you have to come to a stand and say, I want to understand, I want to have a better picture. a broader understanding and awareness about why why people do what they do, why they behave what they behave, and why they act the way they act. So everything is acting from the load they carry. I say the load they carry. And in different videos, I explained the toxic emotional load, the unhealthy interpersonal relationships, and the trauma bleeding. It is taking a toll, especially on subjective vulnerable. And I stated before, like it is 60% or 62% subjective vulnerable. So we have to understand what type of mechanisms are going on from the neurobiology, from neurodevelopmental, from biomarkers, from cross-cultural interactions and relationships within the environmental context. And environmental, it's internal, what's happening within you on the cellular level, and what is happening outside, and your perceptual experience, how you interpret it. Everybody has a different lens based on where they are, their lived experiences, where they came from, their culture background, their personal background, all this formulate a perceptual experience about the world around you and how you approach it. And sometimes when things repeat itself, it become exhausting, and we say, yeah, enough. Yeah, saturation of data, saturation of experience, of the same experiences, that keep the vicious loop and the vicious cycle for specific individuals who are attenuated to have more dysregulated central nervous system, or more load of stress, trauma, or lived experiences that didn't anticipate in their empowerment, in their to release the veil, or to release the heaviness, or to release the stains that it has been projected onto the person. So there are different mechanisms how we understand ourselves and the world. So I'd like to go further and go for part 8, and I don't know how far I'm going to go with aggression, because it's we witness it in and it is I said it before, when it is proactive aggression, it is calculated, strategic, and we witness it in specific times of the year, specific days, specific events, specific. That is proactive aggression. And when we don't understand all types of from reactive, from proactive, from active, from passive, all these type of aggression and how they manifest cross culturally, that's why I call for the culture intelligence, how the person from a specific group, from a specific background, from a specific upbringing, or attachment style that shaped a perceptual experience about the world and how they would like to approach it. So we have to pay attention to that. Silence is not not everyone is silence, or like just looking and staring is a good sign. It can be a warning sign. Not everyone experiencing extremes in their life is a good sign. It can be a warning sign. So we understand we are energy. We are like, yes, we are activating from central nervous system, that is electrobiochemical. Says everything is either in synchronicity or asynchronicity. Either there is oscillation or there is a dysfunction oscillations between the neurosynaptics and the mind-body connection, and how this manifests either in a sympathetic response or a parasympathetic response. I'm still continue this series because I'd like to bring this awareness, and I would like to put something that makes somebody think differently about aggression. It is not all about what is seen. It is all about what is brewing and what is behind the scene. That is very complex, and it needs or worthy the chance for navigation and exploration. Why not? As we live in a world unpredictable, uncertain, and everything can change in a second, and we would like to know a way better for life, for whoever living on this world and the new generations, what they are modeling, what models they are observing from. Social media is very a double-edged sword right now. Is becoming heavily impacting the neurocircuits and the perceptual experience of individuals. And it is not only perceptual, it is not only psychological, mental, emotional, it is physiological. So we have to approach everything from the physiological response. What drives this physiological response? So I'm gonna bring today something really interesting: the intersectionality between cognitive distortion, dissonance. My apology, cognitive cognitive dissonance, self-distortion, self-deception from behavioral neuroscience perspective, with attenuation to cross-cultural hate, rejection, environmental and contextual influences. So within the lens of neurodevelopmental, stress, trauma, and the state of health and disease. So I started my series on aggression. It is the neuroanatomy of. I love the neurobiological pathway that shows me exactly what is happening inside and outside, and give me a new lens of understanding and what am I going to do with this. So aggression from behavioral neuroscience perspective, aggression is modulated by circuits involving amygdala, prefrontal cortex, and HB axis. The amygdala triggers aggressive behavior, stimulation augments aggression, while lesions can blunt social dominance or aggression depending on context. The prefrontal cortex, especially medial and orbitofrontal regions, and orbitofrontal regions is so important for the social interaction and the response. Support impulse control, hypoactivity. Here is linked to violent and antisocial aggression. The HB axis or cortisol, that is the stress hormone, interacts complexly low cortisol is associated with proactive bland aggression. While reactive impulsive aggression may correlate with elevated cortisol. So lower cortisol level, that is proactive bland, because no remorse, no feelings. They mimic human emotions, but they don't feel it. In early life stress and trauma and genetic predisposition, I stated before, MAOA gene variants can shape aggression via their impacts on amygdala development and stress regulation circuitry. In disorders like antisocial personality disorder, reductions in gray matter in prefrontal cortex, amygdala, and insula correlates with emotional regulation difficulties and increased aggression. Exposure to early adversity, chronic stress, or trauma disrupts normative neurodevelopmental, increasing vulnerability to aggressive behaviors through dysregulated HB axis or hypothalamic pituitary adrenal axis and impaired prefrontal amygdala control. Cognitive dissonance is the psychological discomfort from holding contradictory beliefs or actions, leading individual to adjust the beliefs or behaviors to restore consonance. This is when you feel, and this is where the shame and guilt can press on, and they can alter the state of what I am believing, or it's maybe so it adjusts beliefs. It's it can have a part of manipulation of the person, especially subjective vulnerable, to convince them to comply to the aggressor or demands or commands. For functional MRI, research shows that during difficult decisions, increase the activation in right inferior frontal gyrus, medial frontoparietal regions, and the ventral striatum, and decrease the anterior insular activity, are tied to rapid unconscious rationalization processes. The anterior cingulate cortex, or ACC, responds to conflict or error, triggering discomfort. The ventral striatum and the prefrontal cortex are implicated in attitude change and resolution of dissonance. Emotionally, left frontal activity associated with approach motivation like anger may drive dissonance. Resolution, when one can assert control, otherwise lacking control, defensive or antisocial reactions may occur. In individualistic cultures, for example, the Canadians, typical dissonance reduction, like attitude shift after choice, occurs robustly. In interdependent, interdependent or collectivistic cultures, like Japan, dissonance reduction is less common for personal choices. Self-worth is tied to relationships and social harmony, because they have familial piety, the loyalty to the tribe or the family, and adherence to the elder and respect to the elders. Harmony, not internal consistency. However, reduction may occur when decisions involve close others. So this is a contradiction between what I like to do and what the family would like me to do. Therefore, that is for instance, and it is heightened among adolescents because of their pruning and their hormonal changes and the neurodevelopmental stages. Self-deception refers to maintaining beliefs contrary to strong contradictory evidence in order to preserve or positive self-image. This is, we call it self-deception, like fake it till you make it, or people pleaser, as like phoning. it is hard to say no. They want to be perceived as the giver, or they are the one who's always like adhering or listening to fit, or to fear of excommunication and exclusion from the inner group. And for non-clinical individuals, frequently reshape personal narratives to stay coherent and favorable. These distortions are motivated, sometimes adaptive, aiming at emotional stability, avoiding anxiety, preserving identity. So it is like the capping or the masking till the storm pass, or as we mentioned, fake it till you make it, but it doesn't work like that. In disorders like reverse Othello syndrome, failure of reality monitoring are tied to right hemisphere dysfunction, affecting the discrepancy detection mechanism. Neuroimaging indicate that caudate and medial prefrontal cortex circuits mediate the dishonesty and self-deception. Reduced caudate activity correlates with higher cheating and generation of false self-efficacy beliefs in ambiguous contexts. So we understand that how the neural function and the structure impact or are impacting the behavior or the perceptual experience. Cheating or deceptive behaviors, possibly shaped by stress or ambiguous contexts, can shape underlying reward self-evaluation circuits like caudate medial prefrontal cortex, promoting self-deceptive beliefs. Projection involves in attributing one's unwanted feelings or anger. So somebody would like to put all what they think of onto others, but in a negative way. Onto others, a classic Freud defense in early, that is psychoanalysis. In early development, infants use projection to manage unbearable impulses by externalizing them onto caregivers. In adult context, projection or projective identification may serve to justify aggression. For instance, provoking another into anger so one can credibly attribute one's own anger to that person. So they don't blame themselves on being the provocative side of the behavior. No, they due to their understanding of the vulnerability of the person that they are poking or provoking, they know exactly, they know the pattern, they understand the novelty of the behavior. So therefore what is expected is going to be projected, then the blame is not going to be onto them, is going to be onto the one who upon the projection of anger occurred. Cognitive dissonance can fuel hate. After committing violence against an outgroup, individuals may develop enduring hostile attitudes to justify their actions and reduce dissonance. So, not feeling the shame or guilt or the remorse, and they know that they start to fuel their action through like more aggression of verbal, maybe physical, or any other form to escalate the not de-escalating, to prevent or to move away from this what already took place in the injustice. Emotion expression norms vary in individualistic cultures like US. Emotional expression is valued at personal authenticity. Collectivistic societies like Japan emphasizes suppression for group harmony. So we have very explicit and we have highly implicit, or some can express their emotions and they understand the right for expressing their emotions. Others, when it comes to the personal emotion, they have this guilt that it is they don't deserve it. They can't feel this feeling because the priority to the tribe or the family or their community. In chronic stress, trauma, and adverse environmental disrupts normative development of emotions regulations systems like prefrontal cortex, amygdala, HB axis, fostering maladaptive defenses, projection, and self-distortion. Aggression and stress linked pathology. And when we say pathology, this means that there is abnormality, there is a disease. So when we understand aggression, it is a disease. It can be acute and chronic. Cross-cultural value systems modulate whether individuals resolve internal conflict through self-change, more likely in individualistic contexts, or relational adjustments like in collectivistic context. So aggression and cortisol dynamic, like serotonin, amygdala, prefrontal cortex interaction, we see through the fMRI studies on cognitive dissonance and rationalization, the neural basis of rationalization, projection in infant development is the cognitive control process, self-deception neural correlates. So we understand what actually happening from the intersectionality of the neurobiology and the behavior and the phenomena, or the projection of specific behaviors onto others and group. Cognitive control processing and defense mechanism influence aggressive and reactions. The neurobiological and cultural nuance of top-down versus bottom-up regulation and aggression, focusing on the perspective of the aggressor. We see the phenomena from the aggressor and the target. From the doer and this is subjective variable, so or the offender and the subjective variable, from the one who has some entitlement or some dysfunctional perceptual experiences about the self and others, that is causing the distortion and manifesting it according to their predisposition, the environmental, their trauma history, the stress level they are going through, and all of this, and their developmental stage. All this correlate within this context. Top-down control refers to the prefrontal cortex. We say that the cognitive approach exerting regulatory influences over subcortical emotionally reactive regions like the amygdala. In individuals with generalized anxiety disorder, there is a disrupted inhibitory influence from the prefrontal cortex, specifically left middle frontal gyrus, to the amygdala, indicating compromised emotion regulation circuitry. In children with aggression issues, resting state fMRI shows increased amygdala connectivity and decreased prefrontal cortex. The ventromedial prefrontal cortex and dorsal anterior cingulate cortex connectivity, suggesting excessive bottom-up emotional drive and weakened top-down restraints. So when we have excessive activation on the bottom-up emotional drive, that is that is hypervigilant, that is distress, that is activation of the negative emotions, and the subsequence of this negative emotions and their neurodevelopmental stages, it will be detrimental how they um, react. A cognitive reappraisal task, a high working memory load in phobic individuals demonstrated top-down suppression of amygdala activity via dorsolateral prefrontal cortex, resulting in reduced fear. Aggression with weak prefrontal cortex control over limbic regions, fight, flight, freeze, fawn, fiend as well. Limbic regions may be prone to impulsive reactive aggression. Training that strengthens prefrontal cortex regulation via reappraisal, cognitive load exercises, or mindfulness can enhance top down control and reduce aggressive output. Uh, for the targets, rely on their own prefrontal mediated top-down responses to manage fear and mitigate threats responses. Improved top-down control leads to better emotional regulation under provocation. So we have to understand, that from the target or the victim. So we have to pay attention from early age. We are working on strengthening this neurocortex area, which will enhance the development of prefrontal cortex through problem solving, through like it challenges. So when they are learning scenarios or role play, or they are being put in a semi-real life experiences, and an open conversation about it and what happened and how why you respond to that. So this is creating a new different synaptic and perceptual experience into the target, who is presenting an opportunity for the aggressor to take advantage of and abuse. Heightened amygdala reactivity and bottom-up signaling characterize aggressive behavior and emotional dysregulation. A neural model of anger escalation shows that the sensory input is processed in temporal cortices, feeding into emotional circuits, which then influence decision making through orbitofrontal cortex, highlighting how bottom up threats signals can trigger aggression when not properly regulated. A strong bottom up provocation, like threat or insult, can override weakened top down control, resulting in escalated aggression. And when a target perceives threat, their own bottom-up reactions like fear and anger need to be managed to avoid retaliatory or defensive aggression. And that's why you understand that know your triggers. Understand that the aggressor, they don't give up, because the reaction they are getting from the target, that what make them happy, that what pleases and make them alive, and this is how they survive or how they function. So understanding this, that the provocative actions from the aggressor toward the target, it is calculated, it is strategic, and you understand the timing, the pattern, the tactics, everything. You started to understand it, and you have fully grasped the intention and motivation behind it, that is gaining control over the target, that is depleting their energy, and that is how the aggressor thrive or uh, uh, have a life over or at the expense of others. So when a target perceived threat, as I said, they have to understand that the importance of the regulation of the bottom up reactions. So that is the sympathetic, that is the autonomic, and that is when combined with their attachment, their trauma, their history, their neurodevelopmental stage, and their environmental and cross culture context. For example, some cultural modulation, for example, a meta-analysis comparing East versus West found distinct patterns in inhibitory control. Eastern cultures show stronger activation of the right inferior frontal gyrus linked with proactive anticipatory inhibition. Western culture shows greater activation in middle and superior frontal gyri, areas associated with reactive inhibition or stop what you are doing now responses. Eastern culture valuing interdependence, so they have this tribal loyalty and familiarity. Emphasize suppression and anticipatory regulation to maintain harmony, aligning with proactive top-down control. Western culture emphasizing expression of autonomy, and autonomy, that is maybe independence, self-reliance, self-esteem, confidence, so that they are able to take decisions. May rely more on reactive regulation, stepping in only after emotion emerges. So wait till you see. Emotion regulation strategies for like a cognitive reappraiser or the strategic reinterpretation. For example, some anger aggression intervention may resemble aggression replacement training or multimodal CBT programming combining social skill trainings, anger control, and moral reasoning. And with moral reasoning, that is when we see the missed developmental milestones, the lived experience, the socioeconomic status, and their body, like the fluctuation of hormone and pruning and things like that. So all this can and the social modeling and imitation type of environment around them, if it is a highly a proactive modeling of aggression and unhealthy relationships, moral reasoning started to deflate or the moral compass is broken down. That is when we say this is missed milestone. Suppose that the individual or the child had been exposed to this to shape this pattern of moral reasoning. Unless it is brought to the awareness and understanding of the family, community, and the person themselves, it is kept like the pendulum or it is not stable, particularly with life events. Effective cross multiple continents, mindfulness-based techniques and methods like meditation on the sole of the feet help focus attention away from anger, reducing arousal and aggression, useful in populations with intellectual disabilities. Emotion regulation training, especially beneficial for individuals with poor inhibitory control, teaching identifying emotion, particularly the negative ones, and understand the skeleton, we call it the skeletons in the closet, understand the skeletons in the closet that doesn't serve you or anyone, and bring it to the light. Bring it to the light. Does it serve you? Are you afraid of confronting them? So this requires preparation and gradually facilitating these skeletons in the closet. And it's a process. So especially beneficial for individuals with poor inhibitory control. Teaching reappraisal and mindfulness practices can help buffer reactive aggression. Sometimes some individuals see the person the same way they perceived them the first time, and they refuse that these individuals can change one day. So they keep repeating the same patterns that provoke the negative emotions into the target, only to for the predictability of the reaction of the target, and that is using it for this their disadvantage. And we have to bring this the awareness into the target. Teaching reappraisal mindfulness practices can help buffer reactive aggression. In extreme cases of interactable aggression, amygdalotomy or lesioning parts of the amygdala has been used as a last resort intervention, substantially reducing aggression outbursts in clinical population. So in extreme cases, surgery is the pathway for aggression reduction. Real-time fMRI or neurofeedback targeting amygdala prefrontal cortex connectivity shows promise in restoring top-down control on conditions like PTSD. So if you don't see it, if you don't understand it, how can you collaborate or anticipate how can you change this over time? So you have, if it is not seen, if it is not measured, it doesn't exist. So for example, another examples of subjective to aggression, consider Eastern culture, adolescents prone to aggression under provocation. In some cultures, the modeling or shaping of the aggressive behavior took place at early age. So it is taken as a culture norm or lifestyle, or this is how you show strength, or this is how you show that you can stand up for yourself through aggression, or sort of the reactive defensive aggression. Their stronger proactive prefrontal cortex control could be leveraged through training in reflective tactics and anticipatory reappraisal, actively planning responses rather than reacting. Culture norms already support emotional restraint, which aligns well with top-down proactive regulation. For example, in Western culture, adults in a high stress job intervention might focus on building reactive top down capacity, such as immediate mindfulness cues or cognitive reframing when anger arises. Why this happening? Why I'm feeling this way? What does it trigger in me? What past experiences it brought, because sometimes it is not the event that happened today, that this event allowed the reliving of unwanted experiences, so the body keeps the scores, so the body took the charge of reactivity or the fight flight. Techniques emphasizing self-expression may need adjustment to incorporate emotional tolerance or delayed response strategies. This needs a training. We are not trained from early age on what human being is, what health means, what healthy interpersonal relationships means, how it looks like, how it is formulated, how it's shaped. All these modalities, we are not trained for that. We are learning just by observing, observing adults first, then peers, then social pressure, then we take all like the individual becomes like an open vessel for the good, bad, and ugly without filtration. And that overload the central nervous system. And that entrapped within your muscles and tissue. It is only needs, it's like the recipe needs just to be reheated in the microwave or the oven. So it's a ready recipe right now, and it is ready only when the right temperature, the right environment took place, the right cues took place, and then the body takes over. Uh, Over and over I stay I have the molecule, the book, The Molecule of Emotions, Dr. Ferguson. I'm gonna send this in a link because this is the first book, not the first book. One of the books, yeah, I started with mindfulness, this trauma, this neurobiology of trauma. But it was like it's a whole world opening into me. That is years ago, like a decade now. A decade, yeah, a decade. The confusion time, the flooding, and the overwhelm and the disruption took around 5 to 6 years. So your body, based on what has happened before, from even before and you are in the utero, and you accumulate that. And when we are not taught how. Um, the human anatomy, we took human anatomy when we took science, we took chemistry, we took biology, we took physics. I was fascinated with physics when I was adolescent. I was fascinated by math and chemistry, and my teachers were projecting something in me, but I didn't see it, and nobody see it. So, as we say, from the culture perspective, experiences shape over time how we are perceived, not who we truly are. So the lived experience, or the perceptual experiences we are collecting across, you are in the valley, you are in the mountains, you are in the heights, you are in the lows, you are in the oceans, you are in the sea, you are in the streams, you are whatever geographical map you are in. There are experiences are gonna shape something in your perception of the reality. So it is all not who we truly are. We I said it before, we are like a collection of the good, bad, and ugly. If it is not filtered, the confusion will be in place, stuckness, or the survival brain, or the tribal survival, or the survival mode is going to be in place. That is stuckness, no growth, no openness, no freedom. Or something you are worried about, anxious about, fear to happen. Your negative emotions will override in your default mood network. So this is I explained the default mood network in the negative. Our brain 95% is for the survivor, from the ancestral. There we have to survive something. We have to chase a tiger, but this is not what you exactly is designed for. You are designed for the balance. What we did, we are not taught the balance. And they say work life balance, I say life work balance, because when you have life, you understand what life means. You can work, you can produce, you can You can have clarity. When clarity is in place, everything is possible, and um, the serenity or the beauty of the soul starts to show up. So I'm gonna look for the book of the molecules of emotions, because this is one I started with mindfulness. That is early way back. I say, what mindfulness? Because when you are in confused state, you want to gather your thought. So that mindfulness.org, that was one of molecules of emotions, I think so. That is one of the books I read, and molecules of emotions. uh, let us see. Yeah, Dr. Burt. Yes, Dr. Burt. I am yeah, and her journey fascinated me, and I said, what? And it brought to me Marie Curie's story and another women scientists, and the challenges they faced, and going through what they think of, and no one believes them, and how the social pressure impacted them on a specific time of their journey. That is when we say your emotions is your physiology, is your neurobiology, is everything. So don't underestimate these processes. Don't never underestimate these processes. Right now, I hopefully I said the molecule of emotion, Dr. Burt, and her journey as a scientist and a PhD student, and how she got accepted, and how she was like, like the zeal and the enthusiasm of the theory and discovery. I understand this, and how it is faced with real betrayal and shifted the whole life. So it's a good story, at the same time, good science to learn how emotions on a molecular level shape the mind and body, and how it impacts health and disease. So Dr. Burt, one of the influencers on me to be driven by the neurobiology of trauma. Not only Arizona Trauma Institute, the National Institute of Clinical Medicine, the mindfulness.org, and Dr. Burton as well. So I have many teachers in the way taught me, and the solitude of the journey of understanding the phenomena of the human behavior from a lens on the molecular level, but it is in a simple, translational, and simplified science as a narrative that can everybody can relate, and whoever would like to learn more why uh, why things go this way, so that may present you a piece of clarity. So I invite, if anyone would like to read the book The Molecule of Emotions, Dr. Bird. She I think her journey ended up in being a professor in Washington University. So and she's still teaching about the molecules of emotions, and she has, I think, videos on YouTube as well. um I love their story. I got like when you like you navigate and you see those who are walking the walk, and their journey and how it unfolds and what challenges they face, like Dr. Frankel, Dr. Basil Van, Dr. Basil Verdock, and others, Dr. Daniel Siegel, all these, they win, Dr. Gabor Mate, all these went through the real journey of transformation, real journey of struggle, pain, confusion, unhealthy relationships, struggles, survival, all. You see the whole phenomena of human behavior within their lens. You understand each piece that you are fearfully and wonderfully made. So, Dr. Bort, this is the one I introduced today. Uh, so I'm introducing, yes, here she is. Dr. Candice Burt, Beyond the Molecule of Emotions. Yeah. I am gonna put that. She has, an impact on me, and how to express your emotions. Yeah. I think you don't meet the people face to face or fr- from their journey. Really. I hope you listen to her talk and her passion about what she's doing and um, how her journey started and the ups and downs. And that is what we see in the human behavior. Uh, it's at all levels. That is the human condition. That is the human nature. You are a pathophysiology are not just like what we say a frame that everybody can see. That is more than you are more than that. So I introduced Dr. Burt today, The Molecule of Emotions. I hope you get the book or you listen to her talk and how she processed her journey. So I am moving into another the BNI. This is another one of the part of my specialization in medical health psychology, from undergrad, masters, and yeah, until now. I'm still that is my focus, and that is what I am passionate about, and what drives me to understand the human phenomena. So this I'm gonna from BNI, I'm gonna see the psychosocial stress activates the HB axis and autonomic pathways, altering immune function. For example, elevated cortisol suppresses immune cell activity and promotes pro-inflammatory states. The prefrontal cortex modulates the immune system via parasympathetic or vagal tone pathways. Robust prefrontal vagal signaling reduce the inflammation. That is another piece of the polyvagal theory, another training I had in the journey. Corticotropin releasing hormone or CRH released in stress not only triggers endocrine cascades but directly suppress immune activity. Immune signals reciprocally influence the central nervous system. Cytokines affect mood. Cytokines are pro-inflammatory. Cytokines affect moods, cognition, and behavior. In individuals with personality disorders, chronic emotional dysregulation, even subtle, might perpetuate immune dysregulation through sustained HB axis activation and compromise the prefrontal cortex. Structure and functional brain alterations are well documented in personality disorders, especially cluster B, borderline, and antisocial. So it is the structure and functional brain alterations are well documented, reduce the prefrontal cortical volumes, notably orbitofrontal cortex, amygdala irregularities, and the enlarged striatal structure. The putamen and the coded. Physiological stress responses in borderline personality disorder. There is a blunted cortisol and heart rate response to acute stress paired with elevated skin conductance, indicative of emotionally driven autonomic arousal despite dampened HB axis signaling. Bottom-up dominance, this is dysregulation, this is autonomic or limbic response, diminishes top-down cortical control over limbic regions, amygdala, leads to impulsivity, emotional vitality, and exaggerated threat response. Biological underpinning are less clear, but likely involve the prefrontal cortex, the amygdala circuitry, particularly in disorders like OCPD, with disrupted serotonic signaling and atypical decision-making, emotional regulation brain regions. Behaviorally, behaviorally characterized by chronic anxiety, avoidance, dependence, or rigid control. Cluster B, another things in cluster B, B and C, I said the R, B, and C, they can be, yeah, they form the majority, especially B, they form the majority of a group. Their perceptual realities can impact their reactive response or defensive response. Chronic emotional dysregulation in borderline personality disorder or BPD and may lead to persistent HB axis activation and systemic immune dysregulation. And when it is systemic, the body will understand that is the regular, that is the baseline. So that is the norm of the body cellular mechanism. The blunted cortisol response to stress coupled with heightened autonomic arousal could undermine effective immune modulation, compromising resilience to infections or inflammatory disorders. Heightened anxiety in cluster C, in cluster personality C, heightened anxiety and hypervigilance may elevate basal stress hormones levels, causing low-grade inflammatory state. And low-grade inflammatory state is under-researched. So because there is a hypothesis that all chronic illnesses is like missing on analyzing low-grade inflammation from early age. Low-grade inflammation, like the subtle mechanism that takes over at a sudden, and the person say, "Oh, how come I got that?" Rigid chronic stress may induce epigenetic modifications in immune-related genes like cytokines expression. So you're dynamic, you're interchangeable. It's all what is going on. So can it change the cellular mechanism? Predisposing to persistent immune dysregulation. Let us see the intersectionality. Individuals do not exist in single axis identities. Gender, race, socioeconomic status, culture, trauma history, or and more intersected to shape their neurobehavioral and immunological landscapes. Culture norms may influence emotion regulation strategies like suppression versus expression. Suppression, collectivistic cultures; expression, this is individualistic cultures, thereby affecting stress responses and prefrontal cortex immune modulation. Adverse childhood experiences, often concentrated in marginalized groups, can epigenetically shape HB axis and immune functioning in personality disorder trajectories. Gender variance studies suggest cortisol and autonomic stress responses in borderline personality disorder may vary by gender and hormonal context. For example, interventions like dialectical behavior therapy or cognitive behavior therapy is more into or more effective intervention for cluster C, personality C. Strengthen top-down control and reduce emotional reactivity, likely benefiting immune function via improved HB axis and prefrontal regulation. Stress modulation therapies, including mindfulness-based intervention or neurofeedback, can enhance prefrontal cortex-mediated control, potentially normalizing immune responses. Psychotherapies not only address symptoms, they may reduce pro-inflammatory cytokines and bolster immune cell count. Monitoring inflammatory biomarkers or stress hormones could inform personalized treatment trajectories. Tailoring interventions to culture and gender identities, understanding how emotional expression norms or trauma exposure modulate stress and immune pathways. Trauma-informed care is crucial, particularly given epigenetic and immunological effects of early adversity, like interleukin-18 methylation, and I said it before, DNA methylation, and histone modifications in gene expression. Link it to post-traumatic stress disorder risk and cardiovascular vulnerability. Understanding how the immune markers as well connect with brain function and mood regulation is central to psychoneuroimmunology. Interleukin 6 elevated in depression. Interleukin 6 may epigenetically suppress BDNF in the brain, affecting the synaptic connectivity and mood circuits, especially between the anterior cingulate cortex and limbic regions. Interleukin 1 beta stress induced interleukin 1 beta in the hippocampus inhibit neurogenesis and synaptic plasticity. Blocking interleukin 1 beta can reverse stress effects by preserving BDNF levels or brain-derived neurotrophic factor. CRP, corticotropic or TNF alpha, interleukin 2 receptors, alongside with interleukin 6 and interleukin 1 beta, they are consistently elevated in major depression, potentially serving as biomarkers tied to chronic low-grade inflammation. And so low-grade chronic inflammation, it is under-researched. TGF beta and IL-8, IL-10, IL-13, these are all interleukins. These show nonce profiles. Some anti-inflammatory markers like interleukin 10 are upregulated in depression. The immune response in mood disorders reflects a dynamic or dysregulated balance of pro and anti-inflammatory factors. These biomarkers can map onto chronic emotional dysregulation or anxiety rooted in personality pathology. For example, a individual with cluster B traits, emotional liability, might show elevated interleukin 6, and interleukin 6 is correlated with depression, yes, Parkinson's, and other neurological disorders and cardiovascular, and 17 as well. C-reactive protein due to stress-related neural immune interplay. Those with the cluster C, avoidant and dependent patterns. So you have the extreme, either avoidant or dependent, and that is how the aggressor, when they, for example, the dependent pattern, they have this love bombing and pull and push dynamic. They confuse, they rip the identity of the target. May exhibit immune signature tied to chronic anticipatory anxiety, potentially disconnect cytokine profile shaped by their stress style. Culture context profoundly shapes which emotion regulation strategies are adaptive. A cross-culture comparison between Turkish and German population found significant differences in intrinsic interpersonal emotion regulation strategies, or IER, interpersonal emotional regulation, IER, and their link to mental health outcomes. In PTSD survivors, Western Caucasian Australians, individuals with PTSD tended toward worry, rumination. This is the suppression and general dysregulation, whereas East Asian Australians exhibited rumination and avoidance, but not suppression or worry as differentiators. Expressive suppression correlates with poorer mental health in Western cultures, but in East Asians or collective contexts, it may align with harmony and show neutral or even positive outcomes. So, the survival of the tribe. Cultures affects whether suppression has interpersonal consequences. Among Vietnamese American adolescents, suppression did not harm family relationships, possibly due to cultural values around the maturity or respect, though it affected peer dynamics. Emotion regulation also occurs at the culture structure level. Norms, social organization, situation selection, and relational arrangements can shape emotional expression and regulation. Trauma-informed feminist therapy, that is another gender-focused, reframes the trauma like borderline personality, like symptoms, not as pathology but as adaptive survival or complex PTSD. And when we say complex PTSD, that is relational, that is interpersonal. So whoever has, and this is when the person take whatever is being projected onto them and act like one, and this can hinder their development in their own life, in their developmental milestones, in their relationships, and their interaction with the world. That is complex PTSD, and I hope that it's going to be added to DSM soon, and and understand that everything, you have to understand it from the physiology perspective, or the pathology, and as a social disease. It's relational, it's interpersonal, how people communicate, relate, connect, all of that, the dysfunctional patterns of the behavior, especially when rooted in betrayal or systematic oppression. It emphasizes the socio-political context, egalitarian therapist, client relationships, and empowerment, not labeling, but understanding responses as adaptive. This is especially vital for individuals whose personality traits are entangled with trauma and marginalization. the victimhood, the perception of the victimization. Interculture therapy recognizes how culture, religion, language, and socioeconomic factors and oppression intersect with the psyche and pathology. Without it, therapists risk misdiagnosis or ineffective treatment. Intersectionality, as coined Krishna, underscores that individuals face overlapping oppression, race, gender, class that traditional single access therapies may neglect. So, as I stated before, the biomarkers for the within the immune system, like interleukin 6, C-reactive protein, in cluster B personality, cluster personality. Again, some of the applications or some things that is measure inflammatory markers, interleukin 6 and C-reactive protein, pre and post intervention. Use trauma-informed feminist therapy to reduce shame and contextualize symptoms. Include mindfulness or acceptance component adjusted culturally, like, for example, suppression versus expression norms. In cluster C, monitor low-grade inflammation tied to chronic stress, interleukin 1 beta and tumor necrosis factor alpha or TNF alpha. Deploy CBT with the culturally resonant reappraiser or adaptive suppression strategies. Use intercultural therapy to align therapeutic methods with values around control, difference, and autonomy. Another thing is that it is biomarker tracking, neuroimmune and endocrine indicators, culture attuned, trauma-informed therapy, intersectionality, sensitive clinical decision making, neurobiological and behavioral goals. So it's like a comprehensive or a holistic or intersectionality between the factors that truly affect the changes in the neurofunction and the structure, and at the same the molecular mechanism between the mind and the body. As I stated before, like biomarker neuroimmune monitoring, like interleukin 6, marker of chronic inflammation associated with trauma and borderline personality disorder, attest through serum cytokine assay. Monthly, it is done monthly. C-reactive protein, general inflammation, that's everybody can do. We did it at COVID. General inflammatory index elevated in stress-related dysregulation. It can be done by blood test and done monthly. Cortisol, diurnal, blunted, dysregulated in borderline personality disorder, reflects an HB axis. The test is salivary collection, AM and BM, because the cortisol in the morning, it's elevated. It's supposed to be at night dampened. What happened if it's it's opposite, or there is always elevation of cortisol levels, and it is done each 2 weeks. Brain drive neurotropic factor reduced in trauma, depression, and emotional dysregulation. It is the test is done blood spot assay, and it is optional, but it's good for the cortices function. It is done like 4 times a year or 3 times a year. Heart rate variability, index for vagal tone and top-down emotional regulation. It is used either between measured by wearable or ECG based, and it is done weekly. So, some of the things that we would like to put in consideration when we are dealing with this elevated biomarkers. So first thing is safety stabilization and trust building. That can take like for an 8-week therapeutic model. Trauma informed feminist therapy, understand the symptoms in the context of structure, violence, and resilience. Culture adapted the DBT skills offer dialectical strategies, but framed through culturally resonant metaphors, balance, harmony, honoring ancestors, spiritual metaphors, grounding and emotional regulation using mindfulness in culture framework like prayer, meditation, dance, or rituals. This is from a specific cultural lens. So what the ancestral they used to do when they deal with challenges, stress, after warfare, all of that, what they used to do. Narrative trauma mapping, map trauma story with awareness of culture stigma around shame or taboo topics. Some topics for culturally is highly sensitive and it is forbidden to speak about. And sometimes it is the elephant or it is the skeletons in the closet. Sometimes these topics, but however, it requires confidentiality, trust, and sure that this information is not going to be used against the individual. Psychoeducation explain like the personality, borderline personality as a nervous system condition, not crazy or reduced stigma, because it's all go back to your neurobiology, that dysregulation of the central nervous system and the alteration of the neurotransmitters, the hormonal responses, as we say, the HB axis dysregulation, the mechanisms of the cell, and the person is acting from sympathetic, not parasympathetic. Sympathetic is fight, flight, freeze, fawn, and fiend, and parasympathetic is rest and digest. That is a calmness, that is attenuation, that is the bonding. So if it is not done from the 5 years of upbringing, the first phase, and it's going to be missed on the second, and see all this build up with the development, with the expansion of their ecological model, the who they are interact, what setting that they are passing through, what experiences, what other mindset, cultures, all of that they are dealing with, unless it is identified and addressed and started to be a way of life of reconstruction and restoration. Many things are being missed about. Psychoeducation, yes, I said it's, as I hope everybody say from now on and state the labels. So I stated for everyone, we master the labels. Sometimes the body language can say more than the mouth speak, and be aware with a person attenuated to their healing and understanding of the toxic emotional load and unhealthy, they can read this, and that is a closure for them. So their closures, it is based on what they have perceived and interpreted, and that can make the decision in silence. See here, so we have to understand what system they are operating from. Somatic, that's the body, the feeling the body. Some are not comfortable within their body. They don't want to stay in within their body. They don't want to listen to their body. So how come they are going to be regulated? So I don't know. I don't know. Somatic or neuroregulation, like the heart rate, the variability biofeedback, salt of the feet, meditation, proven in anger, aggression and management, interception training, and that we activate the pre-aqueductal gray, and we enter into the sense of connection with the self first and adhere what was going on, so we can, after that, after processing all of this, we can, after we reflect and intersect the things that can make sense, we can form or restructure or reframe our understanding about the what had happened and how you move forward from here. Uh, Culturally attuned DBT mentalization based therapy to for insecure attachment and dissociation. Emotional labeling with culturally appropriate language, normalizing soft sadness versus chaotic anger. Soft sadness versus chaotic anger. The stress tolerance strategies integrating culture practices like fasting, like intermittent fasting, music, herbal care, storytelling, and storytelling now is high because it engages it's part of the somatosensory systems integration, and that through the storytelling it's reframing the events in and giving it a voice from the person who has experienced that. So it comes as like a flow of interpretation to their perception of what really happened and making the sense or making meaning of it. Validate collectivist values while teaching assertiveness without disrespect. Uh, uh, like attachment focus, rework relational templates using imagery and inner guided imagery and visual imagery as well is one of trauma informed care strategies. And it takes with the body scanning, the listening to the breath, understand where the tension lies in your body and allow it, don't hold on it, allow it, let it, allow it. And that it takes a lot of courage and realization that the person is saying, I'm carrying too much and I'm not supposed to. So carrying too much onto our bodies, because every day we are interacting with the world, we are loading. You're like constant loading from your environment, so be aware, so don't carry other loads and put them as yours. That is like self-betrayal or self-deception, or like alienation from who you truly are, attenuation with yourself. That is so critical if we understand that. So rework relational templates using imagery and the inner child work in a culturally acceptable way, like ancestor dialogues. Focus on the identity reconstruction, cross cultures, acculturation, stress, empowerment. That is, we see it mostly in like in immigration and migration. They wanna fit, they wanna please, they wanna just to navigate. But this is a survival brain. It is not living, it's survival. So that's why you see all the intersectionality of the collapse of perceptions and the what the person think about the stereotyping, the labeling, the flagging, all of that. Empowerment narratives replacing broken identity into resilient survival self. Reconnection with meaning system, spiritual, familiar, community based, whatever we see, whatever makes meaning into the personal life, hold in that and explore it and understand how to elaborate it in a real action steps. What you want to do in your day, what you want to allow into your space, what you would you like to invite into your mind and body. So this is what you are doing. I am unlearning and I am relearning. I am trying to elevate from the survival brain into the living brain, the living, and that is a huge difference. Collective rituals or family engagement is if it is safe, art to music therapy, link it to cultural roots, community integration through trusted culture centers, immigrant organizations, peer support groups. But you have to understand that when you approach these models or strategies, you are not underestimating the lived experience. You are not underestimating the individual stories. You are not making fun of, you are not taking it for their advantage or humiliating or belittling or framing or boxing. So that is you see here when it comes to the from behavioral perspective, what is the motivation and intention of communication? Uh, for example, culturally grounded somatic therapies like breath work adapted from other religious entities like indigenous frameworks, anti-inflammatory nutraceuticals or omega-3, turmeric, fermented foods, especially if they prefer holistic. And recently, one research stated that women with Alzheimer disease, they have omega-3 deficiency. So we have to understand that because sometimes of the mechanism of the oxidative stress, it doesn't allow the absorption, and some minerals and enzymes break down others under stress, under trauma, under psychological distress, under sleep deprivation, all of that. There are mechanisms that break each other down, so you don't know what deficiency will occur. Suppose that what you are looking for, or some of the strategies like reduction in self-harm or impulsive behavior, greater emotional clarity and regulation through self-report or heart rate variability readings, increase the self-compassion and narrative coherence, engagement with culture and meaning for life roles, decrease in interleukin, the pro-inflammatory cytokines, interleukin 6, stabilization of cortisol rhythm. Another challenge you can face as well, some of the immigrants population, shame-based trauma, patriarchal family structure, modesty norms, intergenerational trauma. So they require like emotional regulation through their practices, breath-focused mindfulness, fasting, as a self-discipline. So they seek the spiritual pathway in or emotional regulation, incorporating religious validations like patience, emotional awareness, are not weakness but strengths. Biomarker integration, like they learn about heart rate variability, cortisol testing as part of the self-care and not a pathology. Avoid direct confrontation or exposure early on. Use respectful psychoeducation with metaphor rooted in the spiritual or their understanding of the spiritual resiliency. Another challenge is community insularity, stigma around the mental illness, familiar pressure. So integrate the therapy within their religious affiliation, or what is the core belief or the core values of their spiritual or religious background. Incorporate rhythms or ritual rhythms. Be sensitive to gender roles and boundaries in the therapy setting. Use group-based DBT or psychoeducation in trusted community and organization. Another challenge can be faced within the immigrants as well: religious rejection, family conflict, acculturation stress, gender-based trauma. So the main thing is the reclaiming spirituality, like they focus on the spiritual and while healing from religious trauma. And that is the dogma, that is the stagnation or the fixation. So into the reclaiming the freedom within your faith. Introduce somatic and expressive therapies rooted in their storytelling, in the way they dance or the way they listen or they learn music. I understand that for reframing biomarkers for the regulation, understand that the sacredness of the body, as we may say, your body is the temple. So how do you that carry your soul? So how you attain to this temple, how you maintain it, how you take care of it, how you are observant, and how you are not inviting something to spoil this temple. Another thing is identity validation. Everybody want to be validated. That is trauma response. No validation. Don't expect validations from others. Try to be. Try to let it be. Everyone, you think that everyone is worried about you. No, everyone has their own race, has their own, unless they are aggressor and they are attaining to a target. That is complete different dynamic. But overall, everyone is busy with what they want, what they do, and things like that. So incorporating art-based intervention. Art is the language of emotions. We say the molecular emotion, but art is the language of emotions. Through the colors, it drives certain emotions, certain experiences. There's the phases of the life. Through colors, it infuses this influx of either wanted or unwanted emotions, and all it is either regulated or dysregulated, and it is all into sympathetic response, how it is represented or reflected. If it is like we say, it can present itself like the way people wear, and what they eat, everything they consume, they take it as their identity. And if these things like is some way is altered, they lose their identity. They don't know who they are. Their whole world is shaken. uh, there's another form of dissociation. This cannot happen to me, and this didn't happen to me. You see, self for the regulated person, this is they have self compassion, because it is when you have this overload of stressors and psychological interference. You have, first of all, you have to have self compassion. You have to understand that you cannot control everything. The only thing you can control is how you respond. Track cortisol dysregulation as part of gender, like minority stress model. Use heart rate variability and mindfulness to restore agency in the body. Peer-led support groups are recommended. Normalize emotional discussion, provide like historically grounded therapy, like framing trauma through intergenerational survival and community narrative, not to infuse anger, because I witnessed that keep repeating the history, not for the wisdom and lesson learned, but to infuse the negative emotions and redirect the action into negative outcomes. And that I said, the history is repeating itself. That is a stuckness. That is the tribal survive. That is not living. And this is what leads to the state of disease over time. Integrate music, rhythm-based somatic and movement therapy. Validate and address racialized psychological stress, like higher baseline C-reactive protein or interleukin-6 due to chronic discrimination. For especially for adolescents, there is some of the challenges indicated that separation trauma, identity confusion, language barriers, hyperarousal. So how the body or can adapt to all of that? Use visual and body-based tools like body map for pain, colors for mood tracking. Create safe metaphorical stories to help regulate emotions and narrate past events. Offer family therapy if possible, but with awareness of trauma hierarchy and loyalty conflicts. Salivary cortisol and heart rate variability tracking. That is part of science-based, that getting to know your brain. Another challenge as well is late life adjustment, cumulative grief, spiritual questioning, body dysregulation. And with age across the lifespan, if it is not addressed early, it truly take havoc in the mind and the body. And you understand that this heavy load of proactive, strategic, and targeted provocative actions, it's a pattern of breaking the dignity and respect for the human subject. And this is not what God has created us for, or He wanted us to continue living in that. He would like us to rejoice in, to be alive in Him. Therefore, shift the focus on meaning-centered therapy like life review, healing, lineage trauma, gentle body awareness like breath, hand-touching heart, and simple somatics. Breath work and movement already is emotions means emotion. Emotions means emotion. but how your body attuned to the motion, because sometimes aggressive emotions can lead to another higher oxidative stress. So it is not unwanted. Know thyself. What can you tolerate, what you cannot tolerate. Don't look to the outside judgment or labeling. They are not in your body, they are not in your life. Everybody making assumption and projections. Don't take it as yours. So, and move on. Address neurodegeneration risk, include inflammatory biomarkers for cognitive aging, interleukin 6 and C-reactive protein, culture wisdom frameworks like the older adults started to mentor or to participate in reshaping young adult life, the lesson learned, the lesson ancestral and dignity as well. To return to that, look at the good things that has been done into your life, and um, bring them to the present. Bring them, because your brain doesn't know is it happen or not. It happens, either positive or negative. So bring the good things that happen through your life into the present moment, and your brain will think it is happening right now. It will relive the good things. So that is what we would like to invite to our life, especially with all this accumulation of reactivity, proactivity, active and passive, and all of it's a lot of things, a lot of dynamics are happening in one setting. So you are not meant to overload yourself. You are not meant for that. What you invite will take a space. So be aware what you invite. What are you paying attention to? If you are paying attention to the positive, you are gonna bring this into your life. So that is what we would like to draw from, and we retrain, unlearn and relearn. There is something with culture narrative mapping, like identity, values, meaning making. That is through lived experience, and that is lived experience through the stories, the story we tell. The story we tell, it is a perceived reality. It is not the whole truth. Nobody hold the whole truth. It is what I thought happened, and this narrative has formulated over time in your mind. So how can you bring this and you make meaning out of it? Intersectionality with stress, the cues that formulate this meaning, from trauma informed lens and culture attenuated and integrative care, especially in borderline personality disorder, complex PTSD, dissociation, and the immigrant minorities populations. We take a lot on ourselves, and we forgot, as a researcher, we are being trained that we have to look at our biases. So we are not seeing the narrative from our lens, but from the lens that being told or observed. So I am forming a clarity and valid views. It is not truth, it's views. It's not reality either. It is what is perceived and what makes meaning out of it. So with this all, we said the aggression and the cluster B and C and the cross culture, environmental contextual perception, All of that, it present us, and the biomarkers present us with some of the phenomena like mood instability, emotional reactivity, impulsivity, self-harm urges, dissociation, blanking out, trust, interpersonal distress, shame, guilt, identity confusion, hypervigilance, startle, sleep disturbances, somatic symptoms, pain, fatigue, suicidal ideation. So don't underestimate the accumulation on the molecular level, and it leads to what it is the extreme and what we see. So some of the questions you have to, you may navigate through this. Um, it's only to bring a sense of meaning to your narrative or your perceived reality, stress, threat, or pain. You have to consci- to know the concept, to the formulation behind it. So there are some questions I would like to share. For example, what are the most important parts of who you are? What what shapes mostly who you are? Okay, the most important part of you. Family roles, religion, culture, gender. How do you make sense of your mental health or stress? The the meaning making. What are things you have done to cope or survive in hard times? It will tell a lot to you. Are you from a tribal survive, or are you from the living? It will tell you exactly. They have distortion, they have dissociation, avoidant, hypervigilance, impulsivity. All of this is going to tell you a lot. Oh, that is why this I do something like that. Are there traditions or beliefs that give you strength or comfort? Looking from lesson learned and the wisdom from the ancestral, or the those who walked the walk. The world is filled with, as it's filled with harm, hurt, and hate and aggression. It is filled with people as well survived this and make it through. So how they make it through, we have to bring this into the light, not only the destructive tools of like social media, or the in group out group conflict. We have to bring it to perspective those who walked the walk and survived and thrived. Are there any traditions or beliefs that give you strength or comfort? Are there things about therapy or healthcare that don't feel right for you? Not everything, not every intervention, not every therapy, not every treatment is one size fits all. You have a unique tapestry of formulation of your value, beliefs, identities, and the way your body interact with your environment. You have differentiation factors. So, for example, you have to see the intersectionality between racial discrimination, immigration trauma, legal stress, religious marginalization, stigma, language or communication barriers, intergenerational trauma, historical violence, poverty, food or housing insecurities, medical distrust or past mistreatment. You have to understand all of these factors that can impact your psychosocial load or psychosocial distress, that it impact your pathology. Another thing, if for things as well. So what others like? Oh, we see all these barriers, or all see all these structure factors that impact the mind and body. Another thing, so that we have to watch for red flags. Each time I bring some of the red flags we need to pay attention to, and we'll learn more about, because sometimes others do it, and this is the lifestyle, or this is the culture norm to prove their strong or strength or power or influence. So but they didn't know this is part of the unhealthy interpersonal relationships and toxic emotional load or trauma bleeding. So we have control disguised as care, like excessive monitoring, a restriction of movement, decisions made for you, and not by you, for your own good. So I made this for you because I think this will be good for you. But they would never ask for opinion, or never ask you what do you think. But things are done for you. In some culture, family or partner control is normalized under protection. Examine whatever autonomy is respected beneath culture framing. Gaslighting or invalidation, I stated, don't wait for anyone validation. Understand exactly what you need and simplify. Repeated denial or another's reality, emotions, or memory. It's all in your head, you make it up. So may overlap with collectivist suppression norms, but consistent emotional and reassure is harmful regardless of culture intent. Isolation for support systems, discouraging outside friendships, professional help, or family contact. It can be normalized in strict family hierarchies or religious groups, but if paired with secrecy or fear, it is a red flag. Don't tell anyone. Don't. So that is a red flag. Verbal or emotional abuse, like mockery, humiliation, threats, silent treatment, yelling, bullying, intimidation, all of this. Expression norms vary, but persistent intent to harm or control is a critical sign of relational toxicity. Jealousy as love. Phrases like "I get jealous because I." It's a sense of love that they are jealous, used to justify surveillance or aggression. In some honor cultures, the jealousy is normalized, but when used to limit freedom, it is abusive. One-sided sacrifice. It's one side, one directional relationship. It's not reciprocal. One only person consistently giving up goals, career, body, autonomy, or identity. Cultural rules like filial piety, wife obedience may pressure people, check for resentment, depression, or suppression. Dismissal of identity, ignoring or mocking someone's race, gender, beliefs, or trauma, and I have witnessed that. They are from they are that than that, and they take it as a joke. Cultural joking does not mean safe connection. Especially dangerous in interracial, interfaith, or queer relationships. Coerced silence or secrets, being told not to disclose abuse, conflict, or health concerns. Can be culture, family honor, but red flags when paired with threats, shame, punishment for speaking up, or intimidation, or is as I say, it is the segregation of the individual. Repeated boundary crossing, pushing physical, emotional, or spiritual limits despite discomfort. When you say no, it is not accepted, it is pushed back. When you say no, you are punished. Culture misunderstanding may explain one time missteps, repeated dismissive behavior shows disrespect. Cycle of harm and apology, repetitive pattern of hurting and loving, the confusion. This is huge in gaslighting and love bombing. So once they get control, the target is the yo-yo. They don't know where they stand, and they lose the control of their identity. They are shattered, known as they start to know that I'm not myself anymore. I don't know the person I'm looking at right now. Known as the abuse repair cycle, often embedded in trauma bonds, and because the aggressor would like to make this codependency or dependency and form this once they got control, then and the hookup, the hookup. So they understand that is already got the target under control. Therefore they switch or flip the other side. This is when the mask falls down. So known as abuse repair cycle, often embedded in trauma bond and normalized in many dysfunctional dynamics. Trauma bonding, when the individual confuses intensity, chaos, and instability with love, especially common in the borderline personality disorder and complex PTSD, or after prolonged emotional neglect. Culture betrayal trauma occurs when someone from the same marginalized group, race, ethnicity, religious, violates trust, causing deeper internal conflict and shame. Spiritual abuse, using religious doctrine or beliefs to control behavior, to suppress an identity and threaten dominations or exile. For example, preventing somebody from seeking help as it is shameful for the family. It could be culture norm around mental illness taboo, and it's a red flag if it is paired with emotional manipulation, threat, and social isolation. So, for example, the way they show up in public, the control of how they show up in public could stem from culture modesty or standards of jealousy, but it is a red flag when it is enforces control, fear, and denies bodily autonomy. For example, the blame game. So it is your fault. You made me do this. You are the one who's responsible. So it can be masculinity or norm vary, but this response can dismiss emotional intimacy needs. It's a red flag if it is persistent, invalidating, or used to deflect emotional labor onto the partner. So when it comes into the pathological states through cross-culture, when mislabeling emotional suppression or somatization without considering culture context, ignoring spiritual, religious, and ignoring spiritual religious concerns, like treating these as irrelevant or delusional, can rupture trust. Speaking for the client or explaining their culture often comes from unconscious bias. That's why we say we are not explaining the phenomena from our own perspective. We have to hear their own voice and their own specific interpretation of the narrative. Often comes from unconscious bias or savior complex, the quick fix. Relying on translators without culture mediation. Translation is not the same as culture interpretation. So translation is getting the formalization within the text, but leaving the soul and the meaning of the story or the narrative. How it makes them feel, what they went through, how they interpret it. Over identifying with the client due to shared identity, it can blur boundaries. So there should be boundaries. Everything is boundaries. If one don't understand our boundaries and respect for that, because we are not an object or not a free entity, so we are humans. We are being in the world for a reason, but however, not to be the scapegoat or the doormat for others' projections. So some of how can I identify the red flags? How can I assist that? There are some questions that can highlight the red flags. Are there any times you have felt unsafe in your relationships, physically, emotionally, spiritually? Are there expectations in your culture or family that make you feel small or unseen? When you disagree with your partner or family, what happens? Do you feel free to express your needs, or is there fear or conflict or shame? Are there things you are afraid to tell people in your community or family? Of course, there is something of what we call it the personal or the private space. So, what is seen into the public is a story, but on the personal level is another story. So, when the more you are asking questions like this, it feels that it is like invading the privacy and invading the personal boundaries and the limitations of the communication. So sometimes some culturally they don't want to disclose everything. They don't want, because this is a part as only I respect, and it is kept only within a specific context. Not everyone is going to ask it is going to be answered. So that is the cross culture or the culture intelligence. The way they communicate, it can indicate a different scenario and perception. Uh, for um, for healthy cross-cultural relations, so we identify the red flags. What is healthy means? The relationship infuse curiosity, not coercion, about culture, gender differences. Reciprocal compromise around beliefs and rituals, emotionally safe spaces to discomfort and disagreement, respect for autonomy even in collective frames, permission to evolve identity, deconstructing rules, gender values. So reframing, reshaping, we are evolving. We are not stagnant. We are not. We are not our ancestors. We are not our past. We are our present, and how we would like to reframe our present. That is our responsibility, and it's supposed to be like. A rule for all communities. It's just we call thrive. We call thrive, but uh, s- still, you have you have to set your boundaries, but it comes with a price. When you set your boundaries, it comes with a price, especially with a specific context and frames. But you have to understand that. So another red flags for other um, their motivation and intention of control, power, and coercion. So they want to torture the person, and this torturing, I said that this compared with torturing in the attain pleasure from this. So some red flags: attempts to control where you go, who you see, what you do, constant monitoring on phone, social media, finances, and location. Make decisions for you because they know better. Pressures you to keep secrets or avoid certain people. Uses jealousy as justification for controlling behavior. Threaten to hurt self or others if you assert boundaries. For red flag, frequently mocks, humiliates, or belittles you. Dismisses your emotions as too sensitive or crazy. Denies past statements or actions. I never said that. Makes you feel like you are always wrong or walking on eggshells. You don't express your voice or views, or you are invisible. Minimizes your trauma or identity struggles. They use your trauma for your disadvantage. They are not helping you in the healing process. Uses culture or religious beliefs to shame or silence you. Discourages or forbids you from seeing friends, family, or support. Makes fun or of or pressures you to change your culture or gender identity. Invalidates your faith, spirituality, or uses theirs to control you. Dismisses your experience with racism or oppression. Forces you to conform to gender rules or norms you are uncomfortable with. Ignores your requests for space or silence. Touches you without consent or uses affection as manipulation. Pressures you into sex or intimacy when you are uncomfortable. Shares your private information without permission. That is when, what information and who, it can be a double-edged sword. How it's going to be used against the person, it's really detrimental. And this is when it comes with moral reasoning and the moral compass. If it does not exist and it has is all this corrosive intentions, it can be used for the disadvantage. Violates your personal, spiritual, and emotional boundaries repeatedly. More red flags for intimidation and abuse. Yells, throws things, or uses physical intimidation. Threatens violence against you or others. Hurts pets, damages belongings, or harms your environment. Uses immigration, housing, or children to control you. Engages in self-harm or suicidal threats to manipulate you. Other red flags, relationship cycles through chaos, apology, or honeymoon phases. You feel confused, ashamed, or numb around this person. You justify or hide their behavior to others. You often wonder if you are overreacting or crazy, so they allow you to inflict or to question or doubt yourself. They claim they are the only one who truly loves or understands you. So, if there are any of these behaviors you have been experiencing or have experiences, how they impact you on your current life or present life, how they impact you on daily basis, how they impact your interpersonal relationships, your communications, your engagement within with others, how they impact you. The more severity of the corrosion or the abuse, it depreciate the human identity. See if there is a conflicting you feel like conflicted between culture, expectations, and safety. Gender scripts, community norms, are they there? And family roles, are they there, or are they formed to harm and not to protect or nurture or support? Either shame, fear, or isolation due to intersectional identity factors, race, religion, immigration status, and identity. Try to ask yourself some of these questions and see how you respond to them. What can be done differently if you have the proper state of self-reflection? What would you wish could happen? And you're going to start to do it for yourself. Don't expect it from the abuser or the aggressor. Be clear and straightforward with yourself. Make a space or create this personal space to self-reflect and think clearly. Clarity means understanding, and when clarity comes, healing occurs. So, if the questions that I have asked came with many yeses, so the subjective vulnerable people may experience chronic or complex trauma, often with histories of abuse, neglect, or systemic oppression. Have intersectional identity, race, gender identity, sexual orientation, immigration status that expose them to multiple overlapping forms of marginalization. Exhibit heightened vigilance, distrust, and dissociation as adaptive responses to unsafe environments. That's from Dr. Van der Kolk, The Body Keeps the Scores. Face and internalize stigma or self-doubt, that is with gaslighting and love bombing, including shame, guilt, and cognitive distortion, self-blame, learned helplessness. Have reduced access to culturally safe or affirming care and may experience re-traumatization or invalidation in healthcare system. Because of what the molecules of emotions, it doesn't have a diagnosis, but once it is put in place, it manifests in a specific organ or a specific disorder or disease. However, we're treating the organ, we're not treating what led to that on a molecular level. So it's a complex, but it takes a village. It takes a village. Struggle with emotional regulation and in relational boundaries due to attachment disruptions or borderline traits. So they may be attracted to the same dysfunctional pattern of relationships and leading to the vicious cycle. Be subjected to structural violence such as poverty, discrimination, or legal vulnerability. So, how to create safety? Validate lived experiences. Actively acknowledge trauma, identity, and culture context without minimizing or pathologizing. Establish clear boundaries and predictable routines. This help reduce hypervigilance or increase trust. Use trauma-informed language and approaches, avoid coercion, provide choice and transparency in treatment or intervention plans. Ensure confidentiality and respect autonomy, reinforce the client's control over information sharing and treatment decisions. Address intersectional risks, understand and mitigate compounded vulnerabilities like racism and trauma. Provide safe physical spaces for in-person care, ensure privacy, comfort, and absence of triggering stimuli. Recognize early warning signs of distress or risk, identify supportive people or services, strategize for self-soothing and grounding, access to emergency contacts and crisis resources like SAMHSA, or Substance Abuse and Mental Health Services Administration. How to promote autonomy and self-efficacy, collaborative goal setting, engage clients in defining their own treatment or recovery goals, strength-based approaches, highlight resilience, culture, resources, and survival skills. Psychoeducation provide understandable information about trauma, stress responses, and coping to reduce self-blame. Skill building, teach emotional regulations, assertiveness, and boundary, and emotional regulations, somatic experience, and boundaries. I am heavy on that. Support culture identity, encourage connection to culture practices, language, spirituality, and continuity as resources of strength. Encourage peer support groups or community involvement to reduce isolation and promote belonging. Connect clients with culturally competent advocates or navigators who understand the systemic barriers. Support the self-advocacy skills to negotiate healthcare, legal, and social systems. Some considerations, for example, for borderline personality disorders, traits, we use DBT-informed approaches emphasizing validation and skill training. For immigrant populations, accounts for acculturative stress and possible distrust of institutions, use culture-adapted frameworks. For children and adolescents, incorporate family or school-based interventions and age-appropriate empowerment tools. Look for the vulnerabilities and resilience within the neurobiology correlations and the biomarkers, like elevated inflammatory markers like interleukin 6 CRB may correlate with trauma and stress, but can be reduced by psychosocial support and safety. Dysregulated HB axis functioning cortisol abnormalities can improve with empowerment-based interventions that reduce chronic stress. Heart rate variability is a biomarker of autonomic regulation. Interventions promoting safety and empowerment, like mindfulness, it can increase heart rate variability and emotional regulation. Final thoughts I'd like to focus on again. It is so critical to focus on the critical developmental periods in across the lifespan, where identity, autonomy, and social belonging are forming. This is the sensitive developmental stages, so critical to pay attention to them, where identity and autonomy and social belonging are forming. That when the shakiness between the subjective vulnerability and the aggressor in started the tribulation of the foundation of who they are, and they don't belong, and self-infliction and self-harm and others as well. Have histories of trauma like abuse, neglect, community violence affecting brain development and stress regulation. Experience intersectional pressure, race, ethnicity, gender identity, sexual orientation, disability, influencing self-esteem and access to resources. Emotional dysregulation, impulsivity, and withdrawal as responses to stress or invalidation. Maybe heavily influenced by peer groups, family systems, social media environments. Have limited power in decision making related to healthcare, education, or safety, which can increase feelings of helplessness. It is important to use the simple and clear language about safety and boundaries. develop like predictable routines and consistent caregivers to foster secure attachment and emotional, because the inconsistent caregiver model, unfortunately, it bring the individual into the abandonment, to the betrayal, and self-hatred, and the infliction, or the self-infliction, self-deception, distortion, dissociation, and all the, I see, the separation between the mind and the body, and no integration. Respect youth the need for privacy and confidential spaces, especially around sensitive topics like identity or abuse. Recognize the role of technology and social media in youth social safety and risks, provide digital safety education. Collaborate with the schools and youth organizations to create safe, affirming environments. Include family or guardians when appropriate, but prioritize the youth voice and consent, especially in contexts of abuse and neglect. And be sure that there is a high vulnerability. And I would like to add another link is the National Child Traumatic Stress Network. I'd like to add this one as well. Okay, I'm adding it again later. Yes. I added this link, the National Child Traumatic Stress Network. It's a good link to understand the lived experience. Um, tools like my safe space maps where youth identity safe, identify safe people and places. What I stated before, safety is different from one person to the other. So I have to understand, and this is giving the voice, giving the respect, and empowering them to express what safe means to you. When I say the word safety, what triggers, what came right away into your mind, or what experiences shaped this definition or this perception or understanding. Teach early recognition of danger signs like emotional triggers, bullying, exploitation, manipulation. Uh, Teach at early age what you are looking for to do less of, and what you would like to look for and do more of. So I am giving which circle is taking sometimes like in one of the exercises we say okay, I hope I can say it. I have two circles. See here, for example, yeah. So there is the small circle. Okay, it can be smaller than this, and there is a big circle. What takes space here, and what you want to take space here. Here, the bigger circle, that's what I would like to infuse on the positive and the good actions that will promote or regulate the central nervous system. This is what I want to see more of. Sometimes the person say, no, these things are in my small circle, but the negative one are in the big circle. So this is when we understand how they perceive this dysregulated state of their body and what occupy their mind, and taking space more than it needed, and it is allowed over time because of the cellular mechanism thinking this is the norm, replicate. So encourage active participation in their care and decision making. Use strengths-based approaches, highlight talents, and say, okay, what you love to do. What you love to do, that will guide us to truly what is their inner longing, or they want to seek in the world, but unfortunately it was suppressed, or it is not validated, or unwelcomed, or unaccepted. So when we talk about talent, that what, and sometimes like some culture would like to keep specific groups and gender or race small, the shrinking culture. This drives a function. Some like the expansion of everyone. So that means promoting talents, promoting critical thinking, problem solving. So things that nourish this brain and the mind and the body, that regulate automatically the central nervous system as a pattern of the lifestyle, as you say, as the culture norm, as you say, and these are the thrive cultures. So resilience, what resilience means? Resilience does not mean the challenge is gonna disappear, the quick fix. No, how I am functioning or adapting through the challenge, and what I have learned from it. It's a teachable moment. It's a teachable lesson. So this challenge is here to teach me what it is going to teach me, and why, and what is my role and responsibility in that. We have to understand it. Provide emotional regulation tools such as mindfulness, journaling, creative arts, support identity exploration safely, culture identity, offer mentorship programs connecting youth to positive role models from their culture or community backgrounds. Facilitate peer support groups where youth can share experience and coping strategies, teach self-advocacy skills for school, healthcare and social settings, help youth to understand their rights related to education, health, and safety, include culturally relevant storytelling or rituals that empower collective healing and identity affirmation. Recognize that adolescents bear the brain development, prefrontal cortex maturation, limbic system sensitivity, affect impulse control, and emotional processing. Safety and empowerment interventions can positively influence HB access regulation and neuroplasticity in youth. Encouraging mindfulness and social support can improve heart rate variability and emotional resilience. And you can seek more information about the sensitive developmental stages and how the support system can empower the child or the adolescents to navigate through the challenges within the structure, the systematic, and the complex context within the environment, how to facilitate this. You can seek more insights from the American Academy of Pediatrics, as well. There is the Journal of Consulting and Clinical Psychology as well. Competency in minority children, child development, school bullying, child psychology. There is, I stated that the National Child Traumatic Stress Network. There are many entities that understand the nature of the role of stress, trauma, aggression, and how it is shaped on the level of the neurobiology and the intersectionality within the cross-cultural environmental complex context. So we are in a diverse, but everyone is acting from the training level they are in, or where they are at from their perceptual experience in the world and how they perceive the other, how they perceive themselves. So it starts with you. You give yourself the understanding of utilizing a combination of a standardized psychological assessment, trauma symptoms checklist, emotional regulation scales, psychological biomarkers, heart rate variability, salivary cortisol, the narrative interviews that capture a holistic profile for every individual. Reassess the biomarkers and the psychosocial factors, periodically track intervention, impact, and adjust treatment plans. Incorporate family giver input and community environment assessment to understand the systemic influences on neurodevelopmental and stress exposure. Being said, understand that youth-centered shared decision-making involve youth actively in treatment planning, goal setting, and intervention choices to promote autonomy and motivation. Culturally relevant strengths-based approaches highlights and incorporate youth culture identity, family values, and community practices as proactive factors in therapy. Facilitate connection with peer mentors and support groups that reflect the youth culture and identity backgrounds. Coordinate care across healthcare, education, social services, and community organizations to address multifaceted stressors and systemic barriers. ongoing education and on intersectionality, implicit bias, and trauma-informed care to improve engagement and reduce re-traumatization, support policies addressing social determinant of health, structural violence, and resource inequities affecting vulnerable youth population. We can utilize the digital platforms to leverage apps or wearable devices for real-time biomarker monitoring, like heart rate variability trackers, coupled with culturally adapted psychoeducation modules accessible to youth. Telehealth, like expand access to trauma-informed, culturally sensitive care for youth in underdeserved or remote areas with attention to privacy and digital literacy. Make sure of confidentiality and consent, carefully navigate legal and ethical frameworks regarding youth consent, parental involvement, and confidentiality, particularly in marginalized population. The intervention should be tailored into cognitive and emotional maturity, balancing safety with opportunities for autonomy and identity development. Finally, I would like to just give a scan on the human ecological model. A framework is utilized to understand the lived experience of the vulnerable individual. So the human ecological model, originally developed by Yuri Brenner, 1979, posits that human development and behavior are best understood by considering nested systems. That is system theory of influence that interact dynamically. We have the microsystem, immediate environmental like family, peers, school, mesosystem, connections between microsystems, exosystems, indirect environments influencing youth like parental workplace or community resources, macrosystem that is broader cultural, societal values, laws, and ideologies, chronosystems that is time-based dimension, life transitions, historical context, and cumulative trauma. For a microsystem, early attachment experiences shape neural circuits, limbic system. Stress impacts HB axis and immune function at this level. So the intervention could be strengthening caregiver-youth relationship, school-based mental health services, family therapy with culture competence on the micro level, or the meso system. So it's interactions between the connection between the circle becomes a little bit larger. So it is a co-regulation of stress via social support. This regulation may occur when mesosystem links are weak. Intervention facilitate communication between family and school community liaison, rules integrated care coordination. For on exo or exosystem, that changes chronic indirect stressors influence neurodevelopment, immune dysregulation via chronic stress exposure. Some intervention, advocacy for safe neighborhood, support for parental employment and well-being, policy-driven access improvement. Macrosystems, so we have culture identity shapes neural responses to stress. Systemic oppression contributes to allostatic load. So culturally attuned psychotherapy and racism interventions, promotion of culture's strengths and pride. Chronosystem, so sensitive periods of brain plasticity, timing of stress influences risk or resilience. Early intervention, trauma-informed developmental approaches, support through transitions, for example, acculturation programs. The human ecological model is capturing the intersectionality between individual biology, immediate social world, and larger societal structures. It informs multimodal interventions, help us identify which systems to target for maximal impact. So the human ecological model is impact. It mostly is community impact, is making a sustainable change within the environment. Promote culture humility, emphasize microsystem influences on behavior and health disparities, support longitudinal perspective, acknowledges how experience accumulate over time, chronic system. So, for example, the application, an example for this model application on the micro system, family conflict due acculturation, stress, peer isolation. Mesosystem, limited communication between family and school counselors. Exosystems, neighborhood with high violence and limited resources. Macro system, experience of discrimination and culture stigma around mental health. Chronic system, trauma during forced immigration and disrupted schooling. Some interventions strengthen family relationship with culture sensitive therapy, microsystem. School family liaison to coordinate support, mesosystem. Connect family with community resources for safety and social support, exosystem. Address culture stigma throughout psychoeducation and community advocacy, macrosystem. Provide trauma-informed care sensitive to developmental timing, that is PROM system. So some examples of the human ecological model is the life tree. The life tree on microsystem, that is your close circle. There's family, friends, school, and home. So these are shaping the first modeling of the behavior or and the perceptual experience. The mesosystem, you think about how your family talks with your school or your friends. When these groups work together, it can help you feel safer or happier. Things around you that affect you, ecosystem, even if you don't see them every day. Things like your parent job or safety of your neighborhood can impact how you feel. Your culture and community macro system, this includes your traditions, beliefs, and even how society treats people like you. These can shape your identity and how you handle stress. It changes over time. Chronic system, life changes, like moving to a new place or going through hard times, can affect you differently depending on when they happen. Understanding all these parts helps us see why you might feel upset or distressed sometimes. It also shows us where to find support, whether it is from people close to you, your school community, or even your culture. Think about the people and places that make you feel safe and supported. Notice when things change and how they affect you. Talk without your support system or your therapist about what parts of your life tree you want to grow stronger. So this will help you to identify and visualize the different system influencing your life and well-being, fostering awareness and promoting targeted intervention. Interventions can be by your self-awareness and your understanding of your life tree. So as we say, you are rooted. You are rooted in whatever. Let us think the family is like the roots. Okay, so you are rooted within the family, and then you go to the trunk. This is all where the nutrients are going to be grasping and stemming into the branches and the leaves and the fruits. So what type of good roots um, you wanna nourish? You wanna put good um, nutrients into it. What good nutrients? Good nutrients from beliefs, from thoughts, from emotions, from feelings. And feelings are changing based on the experience and where you are at in life. So feelings that come and go. Feelings we feel all the time. So, so that is a sensory. Emotions is a little bit different because it infuse a lot of embedded trauma or unresolved unresolved load you carry. So emotions are I have a higher impact because feeling comes and go. Feeling comes and go. It's cold and hot and whatever it is. Okay, you feel like you are not focusing with it. But with the emotion, especially with the negative emotions, it can hit hard, especially with the sensitive periods in subjective vulnerability, because they didn't build the capacity of tolerance in the central nervous system. That's your core. So how can we understand that? That whatever load or the input is taking and is internalized into negative emotions, don't ignore that. You have to address it right away. You have to address it, notice it, validate it, and if you are at this time want to sit with it to understand what triggered this and what patterns came flooding, and it gives control to the autonomic nervous system or the parasympathetic response. Understand that this eventually, if it is not addressed with the right context, with the right reframing and reconstructing of the meaning, um, it can impact heavily on the neurofunction and structure and the changes into the excited toxicity ratios. And that what cause the cellular and the tissue damage. So understand exactly the power of what you allow with emotions and what follows the reaction of it. Understand that building the capacity and resiliency and the window of tolerance and navigating through it takes time and intention. And time and intention. Time and intention. So if you are not honest, if you are not open with yourself, if you are not aware, you're going to allow to the maladaptive behaviors to keep happening and happening and happening. Many times I found myself, I have to stop. I have to stop. That is for my awareness. I have to stop. I learned the cross culture and diversity. It is not simple. Everyone is carrying a load, and probably they are not aware of it. They are not aware of it, or the word maladaptive or dysregulation is not fully understood. how it looks like, how it shows in everyday life, how it shows in your response, in your interaction, in your relationships, and your connections with others, how they show up. If you are not acting from a state of awareness and self-regulation, um, hurt people. So you have to be aware of that, and you have to set the boundaries. Aggression is not what you see. It is in this subtle, chronological actions of human life, and sometimes we have to. Sometimes we allow it to carry loads that intergenerational that we are not supposed to carry. We have to move forward because we are suppose you are new generation with new stuff, with new actions, with new future and things like that. But understand when the vulnerability is being used against you, that is the shrinking, the stay small, and it serve a function. So you have to stop that. You yourself, you have to stop that. That is to keep your dignity and integrity as a human being, and you are fearfully and wonderfully made. Hopefully, this intersectionality between aggression, stress, trauma, biomarkers, or the neurobiology, and the intersectionality of the red flags cross culturally, how it is perceived, and the human ecological model, how it shape how you feel, perceive, and you form your life tree. So what kind of tree are you? You can draw it right now. Not you, from micro system to chrono system. So it's all comes. What kind of fruit are you reaping right now? I hope everyone knows the value of life and understand that what is worth it. It is a life rooted in what God's promise, what He said, that you are fearfully and wonderfully made. So I hope that you take something from today's video, and I hope I'm bringing this matrix of aggression into a new perspective and a new light, and understand exactly what dynamics and what systems are you operating from, and what type of environment are you surrounding yourself with. So you are worthy, and you deserve the dignity and integrity that God has created within you. You are created in His image, and that is His promise. So don't forget that. So thank you so much. I hope somebody will watch it and just take a benefit from it. And till another conversation and talk. I wish you well, and peace.